Absolutely. Our guest is Dr. Bryan Vartabedian, and you can find him at 33charts.com. And let's kind of get into this a little bit here as far as physicians and social media, some of the stuff that we're going to be talking about next week. So when you talk to people or when you speak to a group, what do you tell them about why physicians aren't using or utilizing social media that much?
Yeah, I think it's absolutely fascinating. It's because, I spend a lot of time on Twitter and have been blogging for some time. And when I'm working with my referral group of docs here, about 300 docs in the North Houston area, I kind of get blank stares when I start talking about these things. It's like they're completely in the dark as far as the 2.0 world. I've thought quite a bit about it, and I think it stems from a couple of reasons. Number one, there's, of course, the issue of time. Social networking, of course, requires time, and you got to put the time in to get the reward back. Physicians are also relatively, I don't want to say impatient, but they are impatient. I had a peer that I set him up on Twitter, and he sent out a tweet, and he said, "Now what do I get?" And I tried to explain to him that it takes weeks and months of back and forth and sharing with people to develop relationships that can be leveraged in some way in the future. And finally, I think physicians naturally have an issue with transparency. Successful engagement in the social world requires some level of transparency and exposing yourself when you render an opinion. A few months back, I had a blog post, and I said to myself, I'm going to get some of my peers to go on and comment on this post because I know they're going to have an opinion on it. So I sent out some emails to about 10 or 15 of my peers. None of them commented. And so in the following few days, when I'd see them in the physician's lunchroom, I said, "Hey, what'd you think of that post?" And they're all jazzed up about it, and they all had firm opinion about it, and they had read it. When I asked them why they hadn't commented, they would start giggling, as if I asked them to pull their pants down to run around the hospital, And this issue about rendering an opinion and exposing yourself, I think for a lot of these docs, it's a very intimate thing. You and I, we're used to just sort of sticking it out there, and you do what you do, and I write what I write, and tweet what I tweet, and I think we forget how scary it was when we first started doing it.
Yeah, and naturally people are scared of what they don't understand. There's always the whole, and I'll even ask you about this too, because there have been some posts about this recently about Facebook and physicians, patients, and privacy. And is it really a violation of privacy? Do you have a point of view on that?
Well, it's a hot button topic that comes up, and it's something that struck home with me a few months back when I was sitting at my desk over lunchtime. And I got friended on Facebook by a woman from the Woodlands, Texas, where I live. And I saw her picture, and I couldn't remember where she was from. And so I did what I normally do with strangers, and I say, "Hey, did we meet at a party? Do I know you from somewhere?" Very politely. And she came back immediately and said, "No, but I have a 10-week-old baby who is only taking in 9 ounces of milk a day and won't stop screaming, and I read your book, and I need your help." And so here it was in a public forum. Of course, it was a direct message, but it's still not secure. I had kind of established a relationship with this woman, and so what I did immediately was I took it offline and talked to her and saw the baby the next day and kind of got the baby squared away. So these issues are coming up over and over again about, and this happens on Twitter too. Parents probably once or twice a month are trying to reach me on Twitter to ask me questions, both established patients and people I've never seen from other parts of the country. And so it's posing a lot of challenges for us that we've never faced before. And I think there aren't any real clear answers. You have to look at it from a couple of perspectives. One is HIPAA. The issue about discussing issues in a public forum, I think, in general, is just a bad idea. And you can say, well, the patients initiate it, then it's okay. I think sometimes the patients don't think about what comes along with announcing all of your private medical issues in a public space. We all have what we call a digital footprint, and I think that's something we really need to be thinking about and considering. The healthcare attorneys say, well, if the patient initiates the contact with the doctor, then it's not a HIPAA violation, but it's all very, very unclear. So I think any dialogue about patient-specific issues should be left off the table. I also think that the emphasis on HIPAA regulations strictly, I don't think it's enough. I don't think that physicians, you or I, should be discussing specific patient issues. For example, if I see an interesting case at Texas Children's, even if I de-identify the information, I don't think that I should be out there talking about it. Because if I knew that mom knew that I was writing about her, her curious child, to me that would be a breach. You know what I'm saying?
Right, right.
So there's a HIPAA approach, and then there's the whole medical legal thing, and of course, engaging and giving advice and whatnot is just a loaded subject, so I think you have to be very, very careful.
When you were more heavily promoting your book, along with your website at the time, is that kind of how you dealt with those questions? I imagine you got some emails back at that time asking specific questions about specific patients, about the, whoever their baby was at home, and is that how you kind of dealt with that?
Yeah, absolutely. And, I'll never do this again. If you ever write a book as a physician, don't put an information email in the book. But I get probably one email a week, probably 3 or 4 a month from parents around the country, around the world, and the scenario is always the same. It's a baby with intractable screaming, with a pediatrician who isn't paying attention or is ignoring the issues or whatnot, or they don't have a specialty care they can access. And I have a boilerplate response. I simply can't offer medical advice over an electronic medium. It's a Texas State Board issue. It's our malpractice carrier, and I just have to stick by that. So I'll offer some vague suggestions about finding a specialist in their area or some, that sort of thing. But I don't do anything to be construed as a relationship.
What did I am curious because it seems like I've seen a lot of people in the past 6 months. The people that I've seen out there, as far as physicians who normally or blog or something like that, they're writing books as well. What did you? How was the book writing experience, and what did you learn from it other than not putting an email address in the book?
That's a good question. I initially decided that I wanted to write this book because I had seen so many babies with acid reflux disease, and I wanted to write a book that would serve as a resource for these parents who needed some guidance. I had a baby myself who suffered with pretty significant esophagitis, and that's what triggered me to write it. And so the process was really interesting. I found a literary agent. I got a literary agent who shopped the book around New York, and I was blessed because we had about 6 or 7 publishers who all wanted to buy the book, so it led to what's called an auction, which was a very interesting process where they auction and ratchet up the advance for the book. So that was kind of cool. But what's really interesting about mainstream publishing with these big publishing houses is that they promote the daylights out of your book for about a month, and they're also releasing 300 of the books that year, and so they after about 4 weeks you're sort of yesterday's news unless you're a big hit. So my advice to any physician or pediatrician out there who wants to write a book, if you land a deal with a major publishing house, you still have to treat it like it's a self-published book. And I've been beating the pavement for the past 2 or 3 years pushing it, and we're in our 5th printing. That's only because it's a lot of work. And so there's a lot of lessons to be learned, and that's a whole other discussion, but it's an interesting one.
Did you have to do a lot of rewrites for the publisher, or how was that experience?
No, we submitted once, went through a couple of rounds with my editor, then it went through copy editing, which is where they actually do the formal grammar. But my editor was really pleased with it. She moved some chapters around, that sort of thing. But it was really interesting to see how a book gets published and to understand how difficult the book business is. And that was in 2006, 2007. From what I understand, the publishing industry, because of the movement towards electronic books and whatnot, they're operating at such slim margins. These poor editors, they won't pick up books that they don't think are really going to be successful. And so it's a real challenge for them and for authors who have a voice and want to have something to say.